Hello, I'm Michael Yedidia from the Center for State Health Policy and the Institute for Health at Rutgers University, and I'm pleased to be here with Punam Ohri-Vachaspati, my colleague and friend. We've been collaborating on research on childhood obesity for over a decade.
Hello, I'm Punam Ohri-Vachaspati. I'm a professor of nutrition at the College of Health Solution at Arizona State University. Michael and I have been co-leading the New Jersey Child Health Studies since 2009 in 4 New Jersey cities. Michael, it's been great working with you on this study for almost 10 years now. As you think back, what stands out to you in terms of how we got the study started?
Well, our initial study was a response to a request to provide data to community coalitions in those cities that were funded to initiate policy and environmental change to improve children's weight status. So to be useful, the data had to be local. It had to focus on each of the cities, be easily interpretable, fairly comprehensive, and most importantly, directly relevant to informing and tailoring their interventions. It needed to have a very pragmatic focus. We were able to generate rich and comprehensive findings and shared them with stakeholders in each of the coalitions. So Punam, thinking back on that time, what was most compelling to you in leading us to follow up with those households that we initially surveyed in a new study?
Yeah, so our initial work became a rich source for baseline data for our longitudinal study. And the fact that these communities were initiating policy systems and environmental changes to address childhood obesity provided us with a perfect opportunity to design a study framed as a natural experiment to examine how proximity to changes in the food environment would impact changes in children's BMI over time. Michael, we thought about the study design in quite a great detail as we were thinking about the study. In your opinion, what do you think are some unique features of our study?
Well, I think for one, our protocol for reclassifying commercially available data on retail stores to reflect the healthfulness of their inventory was particularly telling. For example, our granular assessment using very explicit criteria for differentiating the inventory of convenience and small grocery store allowed us to capture the consequences for BMI of living close to a small neighborhood store offering a healthier inventory. How about you? What was one of your favorite unique features?
Yes, in addition to our ability to classify stores more granularly, that's something that hasn't been done in the literature. For me, the way we conceptualize exposure using varied lengths of time and geography was an important feature. This allowed us to examine patterns in the relationship between changes in food environment and changes in children's weight status across a range of exposure levels rather than adopting a fixed measure or a particular proximity or a length of time. You know, the current status of our field does not yet justify picking and choosing specific parameters of exposure. So being able to examine patterns of association across several meaningful distances and lengths of exposure, I think strengthened our study design and our findings. So as an example, one of the key findings from our study is that we find that there was a significant impact of change in exposure to convenience stores on children's BMI. We observed significant relationships at 1 mile, at half mile, along with trends that hold at quarter mile as well. And these relationships, as you can see, hold for varying lengths of exposures, also varying lengths of exposure in time. So for densely populated cities, such as the ones that we studied in New Jersey, where convenience stores are to be found everywhere, being exposed to more such stores over time, closer to is associated with less healthy weight outcomes. And I think our findings have implications for designing interventions as well as for choosing meaningful proximity in future research. So, Michael, you mentioned that our ability to granularly classify small outlets. So, can you speak to the consequences of our efforts to further characterize these stores from the commercial data?
Sure. Well, without it, we would have missed one of our key findings, the fact that healthier inventory at small stores makes a difference to weight status. For example, we found no evidence of a positive impact of proximity to stores participating in healthy corner store initiatives, which all stores in all of the cities did. But we did find a significant relationship between exposure to small grocery stores that we identified as offering healthier inventory and improvement in weight status. So the findings suggest that healthy corner store initiatives may be effective, very effective in reducing the burden of childhood obesity if they offer a specified threshold of healthy items, such as was embodied in our criteria for classifying small grocery stores. So setting the actual threshold would benefit from more research building on ours, but this has very big implications for the future of corner store initiatives and making them effective. So Punam, what have we left out of this presentation?
So as the readers will see, our paper is quite comprehensive. We've examined the consequences of exposure to a variety of additional food outlets besides the two that we summarized here. So we've looked at supermarkets, we looked at upgraded stores, and our findings are reported in detail in the article as well as in the supplemental materials.
And I might add that both the article and supplementary materials are available to you through open access.